Any breathing condition or disability or disorder can be very uncomfortable to both the subject or the person experiencing the difficulty and also to those around him or her. And some of these breathing conditions can be really bad, and among them is asthma. Hello everybody, and welcome to Naomi's All-Inclusive World, where today I'll be looking at asthma and just a few things that we need to know as both probably those who suffer from it, but most especially those around a person who might be suffering from asthma. Now, one of the first things I need to mention about this particular condition or disability is asthma is one of the non-visible disabilities. Like, you can't just look at me and conclude that I have asthma. I would have to either tell you that I suffer from asthma, or you will meet me when I'm in the seizure, when I'm having the attack, for you to tell that I suffer from asthma. So yeah, it's one of those disabilities that one has to tell you first, or one doesn't have to, just look at you and conclude that you have. Now, asthma, in the simplest of definition, if I can just put it, is a condition in which your airwaves narrow and swallow, and this actually makes it produce extra mucus than is needed, and this can make breathing very difficult and trigger some coughing, or a whistling or a wheezing sound that is now very common and very much associated with asthma. When you breathe out, and some shortness of breath, where you find like someone is gasping for air. So it's like having shortness of breath and so on. To some people, especially those who either live with this condition or live with a family member who has it, it's not a big deal. It's not really a big deal, but it's not like such a big issue, because either they have learned to live with it or they have learned to contain it and so on. But should it happen to you and you are in a strange area, a new area, or you are surrounded by people who are meeting you for the first time or have no knowledge about asthma, then it can become very serious. One of the things I need to mention that I have covered probably very shortly in one of my many episodes about actually how we show respect to people who live with disabilities and their assistive devices is before you grab my assistive device and try to help me, ask me first. And one of the assistive devices in this case might be the inhaler for a person who suffers from asthma. Now, it's one thing for you to want to ask me if can I help you, use or open up or put on your inhaler quickly if I am still able to talk. But now what happens, for example, if by the time you come across me and I'm having my asthmatic attack and so on, and I cannot do that, that can be very scary and that can be very frightening. Now, one of the things, should you come across such a person who is having an asthmatic attack, is ask them very loudly. Some of them, depending with what stage you find them, their wheezing is so loud, like they're not able to say what they're saying and so on. But such a person will nod. Say, for example, if you're coming across the inhaler for the first time, they will nod, they'll tell you to open it, they'll direct you on how to do that and help them, get it and so on. And just such things. Most of the time, people suffering from asthma actually are able to self-help, are able to help themselves, get the inhaler, open it and so on. But they might need someone's hand should it have advanced before they got to it and they got to use the inhaler in good time. Now, some of the symptoms, or just, the things that might make someone who has asthma, be known like they have asthma, is, like I said in my introduction, there's a lot of wheezing that is very loud. So you who is next to that person, or even next to room and so on, might actually hear it. The wheezing is very loud when they are breathing in and out. Sometimes their coughing is very continuous, so it doesn't stop like a normal cough and so on. They cough a lot. And some of them actually experience very rapid breathing. It's like they're breathing faster than normal or faster than they would. before the attack comes and so on, chest pain and just pressure and so on, and you would see them either cringing or holding their chest, or they will tell you that they're experiencing pain and so on. You know, tightened neck and chest muscles and so on. Then just difficulty in talking, because remember they're wheezing, they're trying to catch breath and so on, so they experience difficulty in talking. And so on. And also they look pale, sweaty, and they might just look like they're sweating, or they're shiny from like a sweaty face and so on. So yeah, and again, most of them would tell you, if they're around you, another way you'll know, most of them will actually just go like, by the way, I suffer from asthma, I use an inhaler, or I'm on this medication and so on. Some of them are very comfortable in their space with just living with this condition, that they will be glad to tell you, so that you know, and in the event that they have that attack, then you'll be helped, or you'll be of help to them. Okay. Now, one of the other thing that I need to mention is, should you be planning to travel as a person who suffers from asthma, depending with what means of travel you want to use, whether you're planning to travel by train, by air, by water, or even just by you know, whatever means, and also depending from where you are and the rules that are there. It's also it's important that you pass such information across. Let someone know that you live with this disability, so that in the event that it shows up, you will actually get better help. Unattended asthma can be very deadly. So yes, you want to let someone know that you suffer from this, so that just in case the attack comes, it will not be everybody running away from you, but instead there will be someone who will come to help you. Imagine actually someone dying, not because they did not have an inhaler, but because they could not actually put the inhaler on themselves, and no one around them could do that. That is like so terrible. So yeah, information is power. And also, just say you're traveling, like let someone know, whether it's a train, I don't know, whatever details you put across when you are booking your travel itinerary and so on. Make sure you mention that you deal with this disorder or this disability somewhere. The information might come in handy. Because again, remember, in today's world, so many people are quick to take advantage of some situations to get away with what they are doing. Take an example of even just the world we are living in, that is full of terrorism left, right, and center. You know, terrorists might want to actually have someone act like they are having an attack, for them to just use it as a diversion of attention for them to do something. So again, if you don't communicate such information, we might actually assume that you're faking whatever you're doing, or you're just actually trying to pull a joke, or you are trying to or you are a potential terrorist and so on, and yet maybe in real sense you actually need help. So yeah, passing such information is very helpful, and especially when we are traveling, when you're traversing from one point to another. Because again, asthma, just like any other attacks, you know, like epilepsy, like you know, just like the diabetic attacks and so on, they don't give us notice. You know, someone doesn't have a schedule that, you know what, you will have your attack next month on a Thursday on this day and so on. These attacks show up when they show up. They come when they come. So it helps a big deal when those around you are aware of what might happen, so that then, should it happen, we are more helpful than just being spectators, or, you know, freaking out and running away. Okay, and as I wind up, just for you to know, asthma is not contagious. So yeah, you sitting next to someone who happens to have this disability won't mean you will get it, doesn't mean you will be, you know, infected with that and so on. And number two, people suffering from asthma, like any other person, are people first. So again, let's treat them as so. They're human beings first. And even in this particular video, I have intentionally made sure I don't call them asthmatic people. They are people with asthma, and they're not asthmatic people. So again, there we go. Let's remember, people are people first. So call me by my name first before the disability. I mean, can you imagine if someone went like, that asthmatic Naomi, it's like it just doesn't feel right. It feels a little better if you say actually Naomi with asthma, because I am Naomi first before the asthma. You know, you are George first before the asthma, and so on. So yeah, with or without asthma or any other disability, any other breathing issue, we are human beings first. So let's always remember that, because like I keep saying, the person suffering with or living with that disability could be you, number one, could be your sibling, your child, your neighbor, your future in-law, and so on, your future employer or employee. So yeah, you want to look at every human being as a human being first. Thanks for your time. I hope this is helpful. See you in my next episode, and in the meantime, don't forget to hit the subscribe button if it's your first time, and like and share and drop me a comment.